Okay, here we are, back. Care of the body after death. Care of the body after death is called postmortem care. A nurse gives postmortem care, and you will be asked to assist. Postmortem care begins when the doctor pronounces the person dead. Postmortem care is done to maintain a good appearance of the body. For the family to be able to view the body, you want the person to look as natural as possible for the family. If you turn to your book on page 857, it talks about delegation guidelines in care of the body after death. When you are going to assist with postmortem care, you're going to need the following information. If dentures are inserted or placed in a denture cup, if tubes and dressings are removed or left in place, do we take any of them out? What do we do? If rings are removed or left in place, if the family wants to view the person's body, and special agency policies and procedures will apply. You're always going to use your safety and standard precautions of bloodborne pathogens when handling someone that has expired. Making sure that you're using gloves if there's any signs of secretions and excretions. The right to privacy and the right to be treated with dignity and respect apply after death. The one thing that I can say is when you have someone that has died, you want to make sure that you're treating them in the same way that you would like someone treating your loved ones after they have expired. You're going to handle them with a lot of care. And within 2 to 4 hours after death, rigor mortis, that's the stiffness or the rigidity of skeletal muscles that occurs after death, will begin to develop. The body is always positioned in a normal alignment before rigor mortis sets in. Making sure, too, that sometimes people do pass away with their eyes open. The one thing you want to do is just put your hand over their eyes, their eyelids, and just kind of pull them down over top of their eyes, if that would occur. When an autopsy is done, postmortem care is not done. The autopsy is the examination of the body after death, and you're always going to follow the agency's policy for an autopsy. So you're going to try to figure out before, after the person passes away, what they're going to do with the body. And a lot of times you will assist the personnel to care for the body. And sometimes that could also be cleaning and wiping and cleaning up any excretions that might have come out of the body at that time. And that's going to end our PowerPoint on end-of-life care. Please refer to your textbook on page 859 for the Dying Patient's Bill of Last Rites, something that I think everyone should know.